The human blood pH and the human health pH. What does it mean? pH is the abbreviation for potential of hydrogen. The pH of any solution is the measure of its hydrogen ion concentration. The higher the pH reading, the more alkaline and oxygen rich the fluid is. The lower the pH reading, the more acidic and oxygen deprived the fluid is. The pH range is from 0 to 14, with 7.0 being neutral. Anything above 7.0 is alkaline, anything below 7.0 is considered acidic. Human blood stays in a very narrow range, right around 7.35 to 7.45. Below or above this range means symptoms and disease. If blood pH moves towards much below 6.8 or above 7.8, cells stop functioning and the patient dies. The ideal pH for blood is 7.4. If you have a health problem, most likely you are acidic. Research shows that unless the body's pH level is slightly alkaline, the body cannot heal itself. So no matter what type of modality you choose to use to take care of your health problem, it will not be as effective until the pH level is up. If your body's pH is not balanced, you cannot effectively assimilate vitamins, minerals and food supplements. Your body pH affects everything. Total healing of chronic illnesses not only take place when and if blood is restored to a normal, slightly alkaline pH. An imbalance in the body's pH may lead to serious health concerns, including hormone concerns, cardiovascular weakness, weight gain or loss, bladder and kidney concerns, immune deficiency, acceleration of free radical attack and damage, structural system weakness including brittle bones, hip fractures and joint discomfort, stressed liver function, low energy, slow digestion and elimination, yeast or fungal overgrowth and tumor growth. An acidic pH can occur from an acid forming diet, the water we drink, including the reverse osmosis water, emotional stress, toxic overload and or immune reactions or any process that deprives the cell of oxygen and other nutrients. The body will try to compensate for acidic pH by using alkaline minerals. If the diet does not contain enough minerals to compensate, a buildup of acids in the cells will occur. There are two factors that are always present with cancer, no matter what else may be present. These two factors are acid pH and lack of oxygen. So can we manipulate these two factors that always have to be present for cancer to develop, and by doing so may help reverse the cancer? If so, we need to learn how to manipulate these two factors. Cancer needs an acid and low oxygen environment to survive and flourish within. Terminal cancer patients are around 1000 times more acidic than normal healthy people. The vast majority of terminal cancer patients possesses a very low body pH. Why? In the absence of oxygen, glucose undergoes fermentation to lactic acid. This causes the pH of the cell to drop from between 7.3 to 7.2 down to 7 and later to 6.5 in more advanced stages of cancer. And in metastasis, the pH drops to 6.0 and even 5.7 or lower. Our bodies simply cannot fight disease if our body pH is not properly balanced. The normal human cell has a lot of molecular oxygen and a slightly alkaline pH. The cancer cell has an acid pH and a lack of oxygen. So cancer cells cannot survive in an oxygen-rich environment. At a pH slightly above 7.4, cancer cells become dormant. And at pH 8.5, cancer cells will die while healthy cells will live. Again, higher the pH reading, the more alkaline and oxygen-rich the fluid is. Cancer and all diseases hate oxygen and pH balance. The proper alkalinity pH of the blood between 7.35 to 7.45 is critical for overall health of the body. Remember that the pH number is an exponent number of 10. Therefore, a small difference in pH translates to a big difference in the number of oxygen or hydroxyl OH minus ions. A difference of 1 in the pH value means 10 times the difference in the number of OH ions. A difference of 2 means 100 times the difference of the number of OH ions. In other words, blood with a pH value of 7.45 contains 64.9% more oxygen than a blood with a pH value of 7.30. Dr. Jerry Tennant, MD, in his book Healing is Voltage, the handbook says, and I quote, "Every cell in the body is designed to run at minus 20 to minus 25 millivolts. To heal, we must make new cells. To make a new cell requires minus 50 millivolts. Chronic disease occurs when voltage drops below minus 20 millivolts. And you cannot achieve minus 50 millivolts to make new cells. Thus, chronic disease is always defined by having low voltage. A glass of Kangen water with pH 9.5 provides with minus 200 millivolts to minus 500 millivolts, which is the oxidation reduction potential, the ORP, to our system. It helps our body to form new healthy cells much easier. I have been drinking this water now for more than 4 years since it was first made available in India. Kangen water is alkalizing, antioxidizing, superhydrating, and contains molecular hydrogen for maintaining health at its optimum. You can watch an online short demo at the link given in the description box. I can get you this water to try out for free. Contact me at any of the available channels given in the description box. See you soon with yet another episode of Kangen Water.